Hi, I'm Dr. Matthew Maggio, owner of Peak Performance Sports Therapy. Got a really great video today talking about order of operations and how basically no one really respects it. So whenever someone has an injury, we always think, hey, we need to either stretch the hell out of it or strengthen it. That is right at the right point, but it's actually not following the order of operations. So many people out there completely disregard it and disrespect it. I find myself in countless arguments on the internet, and we all know where that gets everybody, just trying to have people respect order of operations. These are facts, these are laws. No one can really argue with them. It's not just an esoteric idea that I'm throwing out there. This is true fact. So basically with order of operations, the first thing you have to get first is normal range of motion. If range is limited and things are stuck together, you need to unstick them first. And usually it works pretty well with some type of manual therapy that goes in there and actually addresses scar tissue and dysfunction. The second step is you need to balance strength. So usually when something isn't working correctly, it's compensating in another way. And you're working too hard on one side and not the other. Then you need to kind of make that compensation better. The third step is you actually need to increase overall strength. That's after normal range of motion is restored, usually through manual treatment, and then that compensation is fixed too. The last thing is neuromuscular retraining. Unfortunately, this gets more credit than it deserves. Neuromuscular retraining, basically they like to think that the brain just decided that it didn't want to fire someday, and you get a lot of people out there that say their glutes are inhibited or something isn't working correctly. Our nervous systems are pretty smart, a lot smarter than we are, and if they decide that your glute doesn't want to fire or something isn't working correctly, it isn't a neurological issue, it's because there's some type of dysfunction there. So a lot of practitioners, they like to play around and do some tricks and work on what's called a reflexive change, where they stimulate some nerves and you feel pretty good when you're in the office, but if you check you a couple hours later, you're going to be right back to where you started, because they never respect order of operations. Respect it, follow it, and you and your patients and yourself will have a better resolution to your injury. A lot of people out there just totally disregard it, and that's what happens why you don't ever really get better. So order of operations is really important for everything, and learn to respect it and use it. Thanks for watching, and I appreciate your time.